Namaste to all. Uh, Special pranams to Devasanskriti Vishwavidyalaya. Uh, Thanks to Ministry of Ayush and University of Latvia. Today I would be discussing about Alzheimer's disease, why and how it is a Manasa Roga, and treatment modality will be Sattva Vajaya. So, uh, what is Alzheimer's is because it was Alzheimer's who described it first. It is a progressive cerebral degenerative dementia, which later on becomes aphasia and mute. Plaque formation and tangles has been described. So, does Charaka describe it? Do we call it Avrutavata or Manasa Roga, Manasa Vatavyadi is to be discussed today. Sarvendriyanam Shunyatvam Smriti Balakshayam is the two-line description that has been given. And when we go into what is the status at present, more than 27 million in worldwide has been identified, diagnosed as suffering from Alzheimer's. And the most alarming is that in by 2015, it could have increased 4 times. So to create awareness, November has been earmarked as Alzheimer's Awareness Month because every 33 seconds or so, one American develops Alzheimer's disease. In 2007, when I was at Netherlands treating patients there, I heard a lot about Alzheimer's disease, but it was not common in India. And in 10 years now, it has become uh, common in India also. We find Alzheimer's cases wherein treatment of that is possible because it definitely improves the quality of life. It makes life easier for the patient and for the family because it is initially it is increased memory loss and confusion. People usually think it is senile and it's all right and all that, but later on when they see that there is a lot of difficulty in um, confusion in writing, organizing thoughts, writing, working with numbers, all that, then it will be given some importance and it will need to be identified, diagnosed. And so Charaka and Chakrapani both give the descriptions of this. And Vata Kundalita is similar to the microscopic tangles that we see today. And Charaka has given this too. And they also say that it need not be um, genetic and it need not be given seen in all cases. So when we go through what is this as per Charaka, we see that Sarvendriyanam Shunyatvam, Smriti Balakshayam. So Smriti definitely is involved and it is Anubhavajanya Gnanam Smriti. So memory loss, aggression, mood and personality changes. Dhruti Bramsha, the capacity of logical thinking is lost and discriminative knowledge is lost. So the Dhruti, Smriti, all are lost or changed. So loss of logical thinking, behavioral problems, and in later stages, patient could just wander away without being aware of the environment or the people are where and how they are going out of the familiar places. So it is inability to communicate, difficulty in swallowing. They could forget how to walk, talk, swallow, and bladder and bowel control could be lost. So initially it needs to be treated early and to get improvement in the quality of life. So the decision making discriminative faculty is going to be hampered. So Jadata, Gadgada, and Muka. Jadata is Achadayati Buddhi Shaktim Mukam Badiram Unmattam Nirindriyam Karoti. So all the Indriyas are going to be involved. Gadgada is in inability to remember vocabulary and the topic in discussion. Patient gradually loses control of hearing, thinking, everything. So it is a very important condition that we should be aware of and diagnose early and start treatment early. Today, it is recognized as a degenerative demyelinating progressive condition uh, with relapses and remissions, varied clinical pictures, obstruction of impulses. Similarly, in Charaka Samhita, we find Dhatukarshana Snehadi Gunashunya Chirakalina Vata Kundalita Punarayati Prashamayati. These are terms from Charaka, classical Charaka Samhita, not coined words. So it is Charaka who has recognized it, and the treatment modality that he gives is Sattva-vajaya. He speaks about Bhrigu Rasayana. Any Rasayana, we really need to start with Sadvrutta. So this Manasa Vatavyadi is only treated for Yapanata. It is not a cure. It is a challenge even today. So how to manage it is early diagnosis and as per as per the person. So Charaka says Desha Satmya Rutubala and as per the Shastra it needs to be treated. So every single aspect of the yoga can be introduced for the holistic management. We can also add Smriti Sagara Rasa, Saraswatarishta, Brahmi Grita, and the Rasayana. Then in 2016, we had in Arogya a Sarva Mahila Yoga, Mahila Sabha. Then we were blessed by Gayatri Parivar for the early morning yagna, and all the ladies could take part in that. And why I have put this is not because I am speaking here today, but it is because it is going to be a great contribution to the patient, not only the patients of suffering from Alzheimer's disease, but also for the family and the caregivers, because it is going to be the major part of a Sattva-vajaya Chikitsa. So I would like to conclude um, conveying my grateful thanks to Dev Sanskriti Vishwavidyalaya, Sri Chinmay Pandeji, the Chancellor of the University, and Ministry of Ayush, Professor Vadis Pirak from Indic Studies of the University of Latvia. And for thanks to everybody for giving me a patient listening. Thanks a lot. Namaste.